Right. Do you suffer from neck pain? I don't mean, that you're a pain in the neck. I mean, do you seriously suffer from neck pain? You might not have to. Here to talk about an injection that is helping a lot of people and just making their life so much better is Dr. Doug Yateman from aascend Pain Institute in the Valley. Good morning.
Morning. Thank you for having me.
Well, absolutely. Thanks for coming. First of all, I think so many people do live with aches and pains and back pain and neck pain, and they just think that that's part of life. Take a Tylenol, and just try and, get through the day. Doesn't have to be. That's where you guys come in. There are so many things out there.
Correct. What we try to do, we tell patients mainly, we'll bring the pain down. So we get lucky if we get it completely gone. But if we can bring it down from a real extreme pain to a mild pain and get their activities moving more, that's the whole idea. Bring pain down, increase activity, and that's the whole goal of what we do.
So tell me about this injection. I've never heard of it before, but it's helping a lot of people, and it's specifically for more neck pain, correct?
Correct. Well, this one is anywhere in the spine.
Okay.
I tell my patients all the time, everyone knows about arthritis in the hands and knees. We have joints in our back, so the joints, just like a hand and knee, get arthritic. So the irritations cause pain in the neck, pain in the lower back, and that's usually where back pain starts. A little arthritis kicking in. And that snowballs make other things happen. Today what we do, we have a video of a gentleman who came in who had a lot of surgery in his neck. And from the surgery, he's had different issues, such as stiff neck, painful muscles. Well, if you look at the picture, he has a lot of hardware. He's fused.
Yeah.
He doesn't move. So that part of the neck is not the pain problem. The problem is the lower part, where it's actually moving more than it should, causing arthritis. So what we're doing today is, just like everyone knows about knee injections, shoulder injections, we're doing what's called a facet injection. The joints are called facets. So what we do is take a little needle, numb up the skin, do everything very sterilely, and always use it like a video game. We use the x-ray machine, a fluoroscope. Very little x-ray, but that way we know exactly where we're going. And the medicine gets in the joint. And we know exactly if it's going to work long-term, short-term, what else do we have to do to bring the pain down.
And how did it help this guy or in other people? How life-changing?
Exactly. Like I said, he's been a patient of ours for a while, so we put some medicine in the joints. It calms it way down, and he can go and do a lot more for months, and then it starts acting up again. It's like a bad joint.
Sure.
And then if it seems like it only lasts a short amount of time, we come back and try to numb those joints so they don't hurt.
Okay.
So we're not fixing the problem. We sort of mask it.
Got it.
So we just bring the pain down. I tell my patients, I don't cure pain. I just mask it so it's much less.
But I'm sure you hear just amazing stories like, well, tell me.
Well, the thing is, a lot of my patients, what we look for is bring them, if they come in severe pain, 10 out of 10, on tons of medications. Well, let's bring the medications down so they're more functional. And by the way, we can do these procedures to help bring the pain down with less medication. And that's what we usually do. We incorporate different modalities. We incorporate chiropractor, physical therapy, the injections that you see here. The previous one was a spinal cord stimulator for nerve pain. There's a lot of things we do to bring pain down and hopefully get people moving more, more active, and they can do more things with their kids and lifestyle.
Sure.
So the whole thing just works really well.
Absolutely. Now, I was talking to the doctor about these injections. I'm sure everyone's different, but they can last. This facet injection can last about how long?
Well, we always go for a couple days to a couple months.
Okay.
I explain to people, it's like putting a campfire out. Take a bucket of water. First one might do it. You might need a second one. And then we sort of go from there. And just, everyone understands the knee. I always use a knee for analogy. You put medicine in a bad knee, it's going to last a short amount of time. If it has cartilage and stuff left in it, it's going to last longer. So we really don't give a guarantee it's going to last this long.
Sure.
It gives an idea, A, this is the spot that's causing the pain, and then we see how long it lasts. And then if it doesn't last long term, we change gears and try to make it last long term, but we got the right spot.
But best case scenario could start a few months or
months,
more.
Half a year.
Well, it's fabulous. And in and out, the injection, you're in, out, you're back doing whatever.
Quick and easy. Yep.
All right, great. Appreciate it, doctor. Thanks so much.